Hi, I'm Sarah Bruce and welcome to EHI TV. Now I'm joined by Paul Hodgkin, who's a GP and the Chief Executive of website Patient Opinion. Welcome, Paul.
Nice to meet you.
You're doing one of our sessions later on and it's about radical transparency and new patient relationships. Tell us a bit more about the themes that you'll be going through.
Well, everybody has a voice now. Everybody has a public voice. If you think back to the mid-90s, if you wanted to have a public voice, you had to get a letter published in a newspaper. Now anybody can say what they like on Facebook, they can tweet, they can put photos on Flickr, they can blog, and voice has really been democratized, and that has huge implications for absolutely everybody. It's actually much bigger than health. But that's what we're interested in patient opinion. How can you take that democratized voice and make it so it's as useful for busy staff as it is for patients, families, carers, service users?
So how do you see websites like Patient Opinion playing a significant role in this information revolution?
Well, maybe the best way is just to explain what we do, which is anybody can write their story. So it could be a patient, a carer, a service user, a member of staff, and we preview that, so we make sure it's non-defamatory. And then we direct it to just the right 3 or 5 or 8 people in your health community, as well as putting it on the web so everybody can see it. But a story about dementia in Sunderland would go to the provider, to the PCT, the PBC commissioner, perhaps to the link, perhaps to the local Alzheimer's Society. And same with renal services in Ipswich. So your story gets to just the right people, and about 60% of the time it gets a response, and about 10% of the time you get a service improvement coming out of the end of it. So we see it as a way of collectivizing patient insight, which is not always correct, but often is, about those micro aspects of care which they really care about. Why did I have to wait for 40 minutes in the CT scanner? Yeah, why did you? Good question. And where possible, doing something about it with the frontline staff so that they go home at the end of the day feeling better.
So what you're saying is empowering patients in this way has the potential to really change their care? Empowering patients like telling their stories first off. Okay, they like telling their stories, and they then like being able to show their brother who lives in Cincinnati that they've told the story about your mum's care in Bromsgrove. So one, they like it. And two, out of that comes a lot of thank yous actually. Half the people are saying thank you, so that's very good for staff morale. And about 10% of the time comes something which is clearly a service improvement. So we can take those stories and with the frontline staff make a better health service and move the culture incrementally towards being more patient-centered. What about the wider role of kind of Web 2.0 and Twitter and Facebook? How do you see that being used in the future by staff and by patients?
Well, I think there's lots of ways it can go. Basically, those tools are citizen-centric. They're not organisation-centric. If you have a photo of your dirty toilet at Watford General posted on Flickr, it's really, really hard to know what to do about it, because it'll stay up there for years. So when anybody looks on Flickr, but NHS toilets, there it is. And even though it's been cleaned thousands of times, if you make a fuss, you'll just end up more as likely on the front of the Watford Argus. So you're in a real bind. So what we have to do is to create platforms that are as useful to the NHS as they are to patients, to actually get over the fact that these tools, Facebook, Twitter, are much easier for patients and citizens to use than they are for the NHS. And I think you're going to get systems like Fix My Street, which is one where you can take a photo of a street and direct it to the council saying, fix my hospital. We've thought about doing that. We haven't got around to doing it yet, where all those kind of mobile technologies help to give information back to the system about how it's working. And if the NHS accepts that and dances with it and isn't afraid of it, that'll be fantastic, because that's an absolutely massive free resource. People want their health services to be better.
Obviously it's a free resource, but it's not necessarily accessible to everyone. How are you kind of addressing the access issue? And not everyone has broadband, not everyone even has access to a computer.
Well, it's a really good question, but it's a question that is kind of time limited, because already we're on digital TV. We're working towards getting a text-based service. And as people get 3G phones, they're going to more and more, as those become the norm, actually people will be able to do that on their phone. So I think we will move away from that. That's the first point. It's a problem that's going to decline. Of course, 83-year-old little old ladies are probably never going to have any of that. So how do we get that? Well, we have a way of, on Patient Opinion, you can write your story on a free post flyer, or you can phone us up during working hours and just tell us your story and we'll put it on for you. And finally, if you're interested in service improvements, which is fundamentally what we're interested in at Patient Opinion, we're interested in how do you take all those insights and make them into better services. It doesn't really matter. Access doesn't matter so much. So, for instance, we've worked with Huayin, which is a Chinese service community organisation in Manchester, and they knew that their older Cantonese-speaking elders were having trouble with the ambulance service and with not eating food at the local hospital because they didn't like it. So they took the stories down in Cantonese and then put them on the site in English, and then worked with the PCT and the ambulance service to try and correct those problems. So if you're focused on service improvement, access becomes intrinsically less of a problem, because those communities, at least to the extent that they know what they want, these transparent web tools that put pressure on providers make it easier for them to get what they want.
A couple of weeks ago, I was at a conference and Christine Connolly actually compared, interactive services such as TripAdvisor. Do you ever think the health service is going to see anything on that kind of scale where people are really scrutinising services and hospitals in such a way?
I mean, we often say that we're like TripAdvisor for the NHS. It's not really a great analogy. It gets it over very quickly, but actually what the community that we're really interested in actually are people within the health service. How do you help those busy people make those changes? And that's pretty different to where the TripAdvisor model is. I think that it also, talking about TripAdvisor, sees it in much too consumerist terms. As a GP, ill people make lousy shoppers. They really don't want that much choice. If you're a young fit person and you're going for an arthroscopy, sure, you want the choice. If you're a 68-year-old person with diabetes, hypertension, and is being referred for query carcinoma of the colon, you're not bothered about choice. Okay, so but after you've had the experience, you have a lot of opinions about what it was like as a consumer. So we should, as the NHS should, put the consumerist emphasis after the choice point, not before the choice point. We should make sure that all services, local services, are good, and then we should use consumers' experience to make sure that the services are better for the next lot of patients coming through, rather than you thinking it's going to drive competition. The evidence worldwide is that competition in healthcare doesn't really work because ill people make lousy shoppers.
Okay, thank you very much, Paul.
Welcome.